Hi, I'm Lisa Butter-Smith. I'm a Burst Ambassador. I've been a dental hygienist for 10 years, and I'm also a certified 200-hour yoga instructor. And I'm here today to show you some stretches you can do that will de-stress you, hopefully, and will also just allow you to work healthier and longer. Okay, so we're going to start first with our wrists and hands because they're very important to our jobs. Very easy stretch you can do at the wall. How flexible you are in the wrist is kind of going to determine where or how far from the wall you stand. So keep in mind I've been doing this for a long time, so I can get in close. But you want to just really push through your hands and really flex them up so you feel a little bit of a stretch here. Better yet is if you can turn your hands like this and do the same thing. If you need to walk back, that's fine. And if this is too easy for you, you can start to bend your elbows. The trick is if you start to bend your elbows, you don't want to come away like this because you won't get the stretch. But if you just right here, you're going to get a really nice stretch in your wrists. This is a really good wrist and forearm stretch. And again, if you're not very flexible, you might, be in here doing it and your elbows might be a little bent. All of that is good. The idea is to just really press through the back of your hands. And if you can get further, get further. It's all about keeping the arms straight if you can and pushing through the backs of the arms. And you should feel a stretch here in your forearms. All right, so this is a great stretch for your shoulders and chest. How close you stand to the wall is, again, going to be kind of a reflection on how flexible you already are or how open you already are. It doesn't matter. You're still going to get a good stretch regardless because you're going to stretch to your ability to stretch, right? So the important thing to remember is arm level with shoulder, not way down here, not way up here. And everything is going to stay facing forward. I'm not going to turn with my hips or my legs. I'm just going to turn with my chest this way, away from my arm. And then you're going to feel a stretch in here. And of course, you're going to want to turn around and do the other side. So we're going to do one of my favorites now that stretches in between the shoulder blades on the back. You're going to start, just take your arms wide. First time around, right arm over left, cross your hands, and maybe you can press palms together, or maybe you're just here. Again, either way, that's fine. But what you want to do is scoop down and then pull forward. I'll turn sideways so you can see. So scoop down and pull forward. Down and forward. And just keep the elbows away from your face as far as you can. And then stretch your hands away from your face as far as you can. And what that stretches is in here. And then, of course, you would just turn around and do other arm on top. Scoop down, pull the elbows away from you, pull the hands away from your face, and just breathe into it. I haven't really stressed this part, but you want to not be holding your breath while you do any of these stretches. You want to breathe and let your breath, kind of what we say in yoga, send your breath to those areas you feel getting stretched. Just inhale deeply, exhale deeply, and feel the stretch. Okay, this is going to be a stretch for your back, your shoulders, a little bit of your legs. You want to make an L shape. So you have to kind of judge the distance for your body so that when you come down with your arms straight, you make a nice L shape so that your feet aren't way back here or in too close so that you can't do the pose. You want to step back. Again, arms are at shoulder length. Come in like this and just really push through the wall and stretch out through the crown of the head. You don't want to let everything drop and sag to the floor. You don't want to tuck under your butt too much, but you want to get nice length out through the tailbone, out through the crown of the head, Keep your shoulders away from your ears. Just kind of hold everything together. You want to be a nice kind of firm container, not sucking in your belly, but a firm container so that you're not just dropping or doing this. And again, just breathe. Okay, so this is one of my favorite stretches because it works your hips, which get very tight when you're sitting all day. So if you have an issue with balance, you can always be close enough to a wall to be able to use it to help support you. Otherwise, you can challenge your balance, which is always good, especially as we get older. But anyway, so you're here and you're just gonna pick up one leg, and it's like you're sitting down in a chair. Ankle over the thigh, and you wanna point your butt back, you're reaching for that chair, and you're gonna come down as low as you can. And maybe that's not very low, but I guarantee you, you're gonna stretch to your ability again. So you're gonna feel it in your hip here, and you're just gonna breathe into it. It's always good for stretching to hold the stretch for at least 30 seconds. I know we don't always have that kind of time between patients. You know, you're going to do what you can do. Anything is better than nothing. Just want to make sure you get to both sides. So second side, I'm doing the right ankle over the left thigh, and I'm pointing my butt back, looking for that chair to sit down on. And just breathing into it. Keep breathing. Don't hold your breath. This is a Psoas stretch. Again, if you need help with your balance, you're going to come to a wall for support. And basically, I'll show you this side. You're going to take your leg up behind you. And if you can, you're going to start to pull your leg away, your foot away from your butt there. And at the same time, you want to keep your hips upright. So you don't want to do this. The stretch really comes from how much can you tuck your butt under and pull your leg back at the same time. And that's going to stretch out your psoas muscles, which run from your torso to the top of your leg. Those also get very tight from sitting. They also tend to get tighter as we age. So just a good stretch to keep doing. And of course, again, you want to come over and you want to do the other side. Pull it out, take your tailbone down, and that's it. Okay, I particularly like this stretch because it just releases your lower back a lot. I'm just going to come down, my feet are flat on the floor, and I'm going to squat down and just hang here again for like 30 seconds. And it really does release all those lower back muscles. Now, if you can't do this with your feet flat on the floor, you can come up on your toes, and that might be challenging for your balance. So again, just grab a wall. Either way, it's still going to release a little bit of the pressure off your lower back, which is a nice, release for us throughout our day. If the squatting seemed a little too challenging, this is a good stretch for your lower back as well. Take a nice wide leg stand. Just put your hands on your hips, and you're going to lean forward. The key here is think about all the things I've been saying throughout all of these stretches is keeping your spine long. So you don't want to just fold and round everything forward. You want to keep length as you come forward. And if that means you're stopping here, that is fine. It's all about stretching the back. It's not about how low you're getting. If you can come down a little bit lower, that's great. If you can do a little bit of this side bending with the legs, that will also stretch your inner thighs, which is always quite nice to do. But again, right here, straight line, all of this pulled in, that's fine. That's again, you got to do what you can do for your body, and that's that. Okay, so that's everything. We've stretched from our shoulders down to our legs and everything in between. I hope that you find that this helps you with ease of movement, hopefully even lessens any pain you might feel in your muscles and joints throughout your day, or lessen any pain you might feel when you go home from work at the end of your day. Hygienists have a tough job. We need to be aware of our ergonomics, and that can be hard to do when we're actually with a patient, but we try, right? And even so, we end up with sore shoulders, sore necks, tight hips, etc. So if you have any amount of time in between patients or even at the end of the day to run through everything I just showed you, that should really help create some ease of movement for you and a little bit more health and longevity in your hygiene practice. And so I wish you well with that.